Hi, once again, welcome back to this video, and this is the third video following the previous two. The first one on stem cell therapy on my father's Parkinson's, and the second one, stem cell therapy on my father's Alzheimer's condition. Now the third one we like to get into is the stem cell therapy so that you can get a better understanding of what stem cell therapy and what are the issues that we need to pay attention to when we talk about stem cell therapy. Okay, now stem cell therapy, what is it? Basically, you put stem cells into the body or the specific part of the body to do what? To repair that damaged part of the body, whether it's organs or tissues, and also to regenerate and rebuild the damaged organ and tissue. Of course, the purpose is to treat that certain illness or condition or disease, and ultimately to restore health and vitality. Just as a side point, I want to mention that stem cells have the ability to actually, stem cells contain messages, okay? Messages. With that messages, they can actually, if let's say this cell is damaged, this is a stem cell, okay, you can go in there and pass the message. That's what they observed. That's what they realized scientifically. Pass that message to the damaged cells, and somehow it can repair, okay? In other words, these damaged cells can become healthy again. Of course, the dead cell is gone. Okay? Not only that, stem cells can actually, because of the messages, let's say this is part of your liver organ, this is damaged, you repair it. Not only that, it can actually regrow into liver cells. So that is the wonders of stem cells, okay? Now, stem cell therapy is actually a form of transplant. You all have heard about organ transplant. Now, organ transplant, you transplant the organ. Stem cell therapy, you actually transplanting the stem cells. Now, organ transplants is limited in terms of applications. There are cases where you either cannot transplant the organ or very difficult to transplant, and such as brain. How are you going to transplant the whole brain into, if let's say the whole brain is damaged, and then that brain belongs to somebody else? When you transplant it, is that person is going to take on that person's thought? You know, all these kind of issues. Heart. Very difficult, possible but very difficult. So these are the thing. If medically, of course, if they have a choice, they would transplant the stem cells if the stem cells can cure this particular illness or organs. Okay, some of the common forms of stem cell therapy would be things like bone marrow, which has been around for a long time, and you probably heard about blood transfusion. People, blood is toxic or cannot be used anymore, and they need new blood to go in. Blood transfusion is a form of cell therapy, okay? Cell therapy. Now, back in the 16th century, there's a physician by the name of Paracelsus. He wrote this down as heart heals heart, lung heals lung, spleen heals spleen, like cures like. And this actually sets a foundation for cell therapy as well as stem cell therapy. Today's stem cell research actually is based on this foundation. And mainstream medical research on stem cell therapy is, you have a heart problem. Now what I'm going to do is I look at the stem cells, see which are the stem cells that can grow back into the heart or the artery, and use that and develop it, run all the different trials and experiment, clinical trials. And when it's successful, proven, approved, that is what they do. Specific. Heart heals heart. Lungs heal lung. Okay? Spleen heals spleen. A bit difficult to pronounce. Like cures like. Okay, that is the essence of stem cell therapy. Now, back in those days, 16th century, actually way more than that, it's quite common that the physician use live tissues or live cells to treat disease. But this tradition or the practice or the whatever culture did not pass on. Unfortunately, modern medical practice use drugs and medicines to interfere in the body and in the disease. A lot of times is actually just a suppression. It's not a healing or curing. For instance, cancer. You heard of chemo, you heard of radiotherapy. Actually, what happens in chemo, it goes in and kill the cancer cell. But at the same time, a lot of healthy cells get damaged. Then after that, you hope the body is strong enough to recover. But what often happens is the body collapsed and result in ultimate death. However many years The young ones are likely to survive this kind of treatment because their body is still young, youthful, you know, their cells are still young. So even if you kill that particular portion, even some of the healthy cells affected, they're young enough to survive it, to recover back. People in the older age or the seniors undergo this type of treatment will most likely end up that way, okay? In fact, some of them, the too old, even the specialists dare not use chemotherapy, or sometimes they use radiotherapy, and which have severe side effects. Okay, now, traditionally or historically, it has always taken the cells and tissues from the young, okay, from the fetus of the animals, okay, and then introduce that into the body. Now, in recent years, because of the technological advance and scientific discovery, what happened is they are able to not only freeze dry, they've always need to freeze dry that, okay, except in the early years, they just take it and then do it right away, because you need to freeze dry it, or either you do it right away. Let's say you take the stem cells from this particular animal, or the fetus of the animal, or the placenta of the animal, you need to do it right away, or you have to preserve it. So even in clinics like in Switzerland, the famous ones, that's what they do. They freeze dry it, because they don't wait until you come and then, you know, take it from that. The timing may not be right, is it? So they have to freeze dry it and preserve it. Freeze drying technology allows the stem cells to actually go into dormant stage without losing whatever, you know, the life in there. And then recently, because of the technology, they're able to not only freeze dry it and preserve it in a capsule form. Again, it's a new technology, and that's why in recent years you hear of products that you can consume orally. Okay, so these are the criteria you need to watch out for. Now, the most important factor when you come to stem cell therapy is the viability of the stem cells, okay, the potency of the stem cell, the efficacy of the stem cells. In other words, we need to ask the questions, are the stem cells still alive? Are we taking in live stem cells, or are we taking in dead stem cells? That makes a big difference. Dead stem cells is not going to heal anything. It's not going to do anything, whether it's for beauty, for health, for anti-aging, or for disease treatment. Dead is dead, okay? Now, there are two important things about stem cells that make them so, they give so much hope to the medical world and the health community. Well, stem cells can do this, can do that. Two characteristics, okay? The first one is undifferentiated. Stem cells are undifferentiated, meaning they are not specialized. What does that mean? Meaning stem cells is not a muscle cell. Stem cell is not a heart cell. Stem cell is not a blood cell. Stem cells is not a bone marrow. So they have the potential to grow into all these kind of different cells, but they are not yet, okay? So they are not specialized. We call them, they are not differentiated. They are undifferentiated cells, okay? And the second characteristic that's very important is the ability to self-regenerate or self-renew. In other words, they are able to form exactly the same cells, okay? To grow new cells. The implication is they're able to grow new cells. Okay, the easiest way to understand stem cells is you and I are formed from stem cells, okay? Your mother's sperm and your mother's egg, or the ovum, join together. The first thing they form is called zygote. This zygote is a stem cell, okay? From this zygote, it actually divides into about 300 stem cells. And this pool of stem cells, these foundation stem cells, are used to form different parts of our body, okay? So, that's why stem cells are seen to be, sorry, there's some software running. That's why the stem cells are seen to be so powerful and with so-called unlimited potential, okay? That's how you and I are formed. So if somehow, medically or scientifically, we can take the specific type of stem cells and use it for your body where there is damage, you see, that is the capability of stem cells, okay? So I hope this can help you understand a bit why there's so much fuss about the stem cells, okay? Now, the next thing we need to talk about is the sources of stem cells. Normally there's only three, okay? Sheep, deer, and human. Not of, sorry for the spelling. It should be or, and human. But of course, the long history has been mainly sheep and deer, okay? Human, honestly, as explained by this doctor. Okay, there's a book here. There's a book here. This doctor, he claimed that, or he explained that it's better to stay away from human stem cells for the time being. Okay, not only there are ethical issues, there are also a lot of medical issues in terms of, first of all, where does the human stem cells come from? Okay, maybe it's from a cord blood bank. Okay, fine. Or is it from third world countries? You know, is it illegal? Secondly, have they been tested for HIV, tested for hepatitis, tested for all kinds of virus or viral diseases? This is explained by him. Okay, it's not from me. Okay, I just read and understand it and share with you. Okay, so his standpoint, this doctor's standpoint, is to stay away from human stem cell for the time being. Of course, the mainstream medical is researching, is drawing your own stem cells to treat yourselves. That is different. Okay, that's different because it's yours. Okay, when you take a third-party stem cells, these kind of critical questions need to be answered before you should proceed. Okay, which probably take a long time to come before this become a reality. I think the medical direction will most likely be, you know, the most advanced would be to draw your own stem cells and somehow do something to it and inject it back for treatment. Okay. The next question is location. Why is it important? There are implications on it. You know, traditionally, as well in Europe, you know, shipped from Europe. But in recent years, as we know, there are mad cow diseases, all kinds of diseases, okay, affecting sheep, affecting this type of animals or even deer. So there are concerns that, you know, if let's say the placenta or the, you know, the stem cells from the sheep actually is from the Europe, there is a possibility that, you know, they could be infected with these diseases. And of course, there will be, you know, there will be organizations that certify that this is free of all these diseases. and of course, now China is probably producing a lot of stem cells as well from these animals. And again, the concern is they can spread from Europe to China also. Possible. I'm not saying that definitely, oh, you cannot use all these stem cells from there, but they need to be certified disease-free, and the quality is good, you know. Come back to the same questions. Now the eye is probably more on places like Australia and New Zealand, particularly New Zealand. You see, New Zealand is free from all this so-called mad cow or whatever by the bird flu. They don't have this sort of diseases there. So it seems like New Zealand becomes a hot place to extract or to harvest stem cells from sheep and deer from New Zealand. Okay. Now, again, we come back. We need to pay attention to the quality of the stem cells, whether it's live or dead. Okay, this is very important because your treatment or the stem cell therapy will rely on these two factors. Okay, now the forms of stem cell therapy. Now, stem cell transplant, you can also do transplant, but it's expensive and it probably is going to be painful. It's sort of like a surgery. Now, injection is very common. It's been a long time in Switzerland, you know, back in the 1950s. Until now, the clinic is still there. It actually started by this famous doctor called Paul Nihans. If you search on the internet, Paul, P-A-U-R, Nihans, N-I-E, or Nihans, N-I-E-H-A-N-S. His clinic is called Clinic La Prairie. And if you visit their website, it actually lists a whole long list of all kinds of diseases that you can treat. And they have been there for ages, you know, for decades and decades. And I think the cheapest treatment is 20,000 US, excluding your stay there, okay? So you still have to fly there and pay for your lodging, your hotels and food and whatnot. Now, placenta injection outside of the medical world, I think many salons are actually offering that right now. And of course, these are not, shall I say, these are not licensed, They're not licensed to do this sort of things. You have to use your judgment if you do go to places like that. First of all, again, come back to the question of the quality and the potency of the stem cell. Are they live or dead? You know, where do they come from? What kind of animals did they take it from? Or are they taking it from human? You know, and of course, in recent years, there have been a hoo-ha about cord blood bank. You know, just like when my son was born, I was offered. Sales people approached me. You want to collect your son umbilical cord? You know, and store it in the bank and use for future use. I consulted my doctor, And he said, it's tested that your son do not have blood-related disease, this disease. And at that point, well, 4 or 5 years ago, the doctor said currently it's only proven for blood-related illness like thalassemia, you know, sorry, because of the software is running, thalassemia and whatnot. Those have been proven, you know, but your son do not have that. Do you want to spend that kind of money? So we decided not to. Okay, doesn't mean that 4 or 5 years ahead now, you know, slowly there are more possibility coming out, but there are also other options available. Okay, so you say I regret or not? No, you know. Of course, recent years, as I mentioned, because of the new technology, now you can take oral or in capsule form orally and have these stem cells for whatever purposes, health, beauty, disease treatment. Okay. Now, in terms of approved stem cell therapy, especially in the US, basically it boils down to bone marrow transplant or bone marrow related type of illness. Of course, the research community and the scientific community is working ferociously on illness like cancer, type 1 disease, type 1 diabetes, Parkinson's, Huntington's, celiac disease is an intestine disease, cardiac failure, muscle damage, and neurological disorders. Now again, non-medical stem cell therapy, there are plenty, and in fact a lot of them are not licensed, okay, are not approved by the government, are not approved by the official body. Okay, now once again I would like to draw the difference. Okay, the non-medical world, most likely it will just inject the placenta. Okay, the placenta, they are not aiming at specific part of the body, whereas the mainstream medical world, the research direction is, okay, I want to look at this heart-related disease. They are going to identify from that pool of stem cells that we talked about, they're going to identify which particular type of stem cells that are able to somehow grow into heart-related cells, that particular part of it. Even for Parkinson's, what they're looking at is that particular type of stem cells that can grow into the dopamine producing neurons. Okay, so they are not taking the whole pool and hopefully hit by luck. Okay, that is more for the non-medical, non-mainstream medical type of therapy. The medical will be specific and very targeted. It's going to be fast. Okay, it's definitely, once they've proven it, it's going to be very fast, it's going to be very effective. But of course, you have to think about that as one illness. It's going to be expensive. Okay, it's not going to be cheap, definitely. Now, before I end this, I just like to put 2 articles here, and the first one is actually concerning our Datuk Lee Chong Wei. Lee Chong Wei just recently, I believe in May, I think, because he sprained his ankle just before the London Olympics or something like that. And what they did is the team of doctors in Kuala Lumpur actually injected stem cells into his, I think, ankle or knee, I can't remember it, but anyway, probably some of you have read this, and indeed his knee, or I think ankle healed really fast. He sprained his ankle, so they injected stem cells and he healed very fast, and he went on to, I don't know whether he won the competition. I think he won the competition, right? Anyway, because I was busy, I didn't watch that competition. So you see, this even in Malaysia, you can get this right now. How much it's going to cost, I don't know. But what I heard, there are clinics out there that offer to treat a knee, especially for athletes, treat the knee for using stem cell for 20,000 ringgit. Okay, that's one knee, specific, only for the knee. So you can imagine the price is not going to be cheap. Even the therapy is available, it's not going to be cheap. Okay, now there's another one, I think you believe from Korea one. This is an Alzheimer one. Korean scientists, you know, they are conducting a lot of research, clinical trials right now, and they aim to have this stem cell therapy for Alzheimer's by 2016. Okay, this is the news. So there are a lot of things in terms of stem cell therapy. There's a lot of things happening in the scientific world. Okay, now the next video I'm going to talk about this specific product that my father is taking, and that is a non-mainstream medical product. Okay, it's actually taken from a deer placenta, and I hope you watch that video as well. This is one option for many people who are suffering from different kind of conditions, and I hope the next video will explain clearly what this product is all about. Okay, thank you once again, and I'll see you in the next video. Bye bye.